Education, SNDT Women's University, Mumbai, Dr. S.Z.H. Zaidi, Professor and Director, Institute of Behavioral and Allied Sciences, MIT University, Lucknow, and Dr. K.N. Guru Prasad, Director of Shri Vaishnav Institute of Science, Shri Vaishnav Vidyapeeth Vishwavidyalaya, Indore, and all respected head of the institutes, head of the departments, coordinators, faculty members, and participants. Our bodies are our gardens, our wills are our gardeners, quoted by none other William Shakespeare. With this, I would like to introduce our first speaker, Dr. Sujata Bhan Ma'am, Professor, Department of Special Education, SNDT, Women's University, Mumbai. Ma'am is having more than 35 years of experience in the field of special education, with numbers of international achievements like Best Paper Award presented in Colombo, Sri Lanka. Received fellowship for cultural and professional exchange program through Council of International Fellowship, Sweden. Recipient of educational exchange scholarship for doctoral research at Mauritius Institute of Education, sponsored by UGC and TEC Mauritius. Taught teachers diploma course at Mauritius Institute of Education. Dr. Sujata Bhan Ma'am is having numbers of administrative responsibilities like NACPO team member in 2018, IQAC team of SNDT Women's University 2018, Interagency Working Group Maharashtra for UNESCO under UNDP, board member, Council for International Fellowship India, member of Committee of Certification, Special Children Concession and Curriculum Adaptation of Special Children, Disability Norms of Special Children by Government of Maharashtra, National Institute of Visually Handicapped, Dehradun, National Association for the Blind Mumbai, Rehabilitation Council of India, Indian Psychometric and Educational Research Association, India, member of editorial board of International Journal of Inclusive Education, Research and Practices, member team of referees for International Journal Disability, CBR, and Inclusive Development published by VRIJE University, Amsterdam. She is a member of numbers of national and international committees. She has infinite articles and research papers on her name. Thank you so much, ma'am, for being with us. Now, I would like to take a privilege to share a brief introduction of our next speaker, Dr. S.Z. Zaidi, Professor and Director, Institute of Behavioral and Allied Sciences, MIT University, Lucknow. Professor S.Z. Zaidi is currently positioned as a professor and the head of Department of Clinical Psychology and Director, MIT University of Behavioral and Allied Sciences in MIT University, Uttar Pradesh, Lucknow. He is licensed clinical psychologist with more than 43 years of teaching and clinical practice and trained in Central Institute of Psychiatry, Ranchi, NIMHANS, Bangalore, and Mental Health Department of Psychiatry Council, CAS Group, UK. Prior to joining MIT University, he has worked as a faculty in CIP Ranchi, Deputy Director, Rehabilitation, Head of the Institute, Government of India, Ministry of Labor and Employment, Executive Director, NAB Mumbai, and Consultant Clinical Psychologist in Indian Air Force Station, Lucknow. He is visiting faculty of CIP Ranchi, Mumbai University, Tata Institute of Social Sciences, Mumbai, and many other national institutes. He has been appointed as member Zonal Coordinator Committee of Rehabilitation Council of India, New Delhi for Central Zone, Uttarakhand. He has edited book titled COVID-19, Biopsychosocial Perspective, several researches, publications, and book chapters to his credit. He is an ex-editor, Indian Journal of Clinical Psychology. He is recipient of National Award in Empowerment of Person with Disability. He was honored by President Dr. APJ Abdul Kalam and CS Kang Oration Award for his contribution in promotion of clinical psychology in India. Thank you so much, sir. Your presence in the conference is a great opportunity for each one of us. Now, I would like to introduce our university magnificent scientist and director of Shri Vaishnav Institute of Science, Dr. K.N. Guruprasad. Professor Dr. K.N. Guruprasad is currently working as director, Shri Vaishnav Institute of Science, Shri Vaishnav Vidyapeeth Vishwavidyalaya, Indore. He works in the area of plant science and specializes in photobiology and magnetobiology. He has experience of teaching and research in life sciences of over 35 years. He was a professor and head of the life science department of Devi Ahilya Vishwavidyalaya, Indore. He has supervised the work of 25 research students who have worked under him for obtaining their PhD degree. He has been the principal investigator of various research projects funded by UGC, CSIR, DST, ICAR, BRNS, MPCST, and BASF India. He has worked as a visiting scientist in Kobe University, Japan, and Moscow University, Russia. He has over 85 research papers published in Research Journal of national and international repute. Once again, a very warm welcome to all of you. Now, without taking any pause, I would like to request Dr. Sujata Bhan ma'am to enlighten all of us with your wisdom word. Over to you, ma'am.
Thank you, Dr. Shweta. That was a real long introduction, not so much required, but anyway, that's the protocol. So thank you very much. It's an extreme honor to be a part of this distinguished panel where I'm sharing the podium, even though it's virtual, with Professor Zebi and Professor Guruprasad. And I also have a soft corner for Indore because I started my married life from Indore, and I have a close association with your Vice Chancellor, Dr. Upinder Dhar and Dr. Santosh Dhar. So I thank them for giving me this opportunity to be a part of this panel. Without much ado, let me start my presentation. And one thing more I want to add here is that one very significant thing is today is the International Disability Day. So what better day than today to talk about disability inclusion and rehabilitation. So thank you once again. So I will just share my screen. Just let me know if you're able to see this.
Not yet, but maybe after some time. It is in process, perhaps.
So you will have to give me the right to share. Shweta?
Yes, ma'am.
Yeah, then only I'll be able to share. And let me know if you can see it.
Ma'am, have you put your presentation on a share screen?
Yes.
Okay.
1 second. I'll do it again. Share screen. Yes.
Yes.
Yes, ma'am. Now it is started, ma'am.
Yes. Can you see it now?
Yes, ma'am.
All right. Okay. I would have loved this to be a physical conference, but we have to still make do with this virtual thing. It restricts us to establish that connect with the audience, but well, that's the norm of today. So we have to make do with what best we can achieve. So the theme I was supposed to talk about was disability and rehabilitation. I'm sure everybody knows about this legendary scientist, Stephen Hawking, and everybody is aware that this person had multiple disabilities, but that didn't deter him from achieving what he achieved till the last breath of his life. So we must remember and know what he had to say about disability. These are his quotes. People with disabilities are vulnerable because of the many barriers we face, attitudinal, physical, financial, and addressing these barriers is within our reach, and we have a moral duty to do so. Addressing these barriers will unlock the potential of so many people with so much to contribute to the world. The gist of this is that we often underestimate the potential of any person who has a disability, not realizing that none of us are perfect. We all have some disability or some handicapping situation where we feel just as disabled as anybody else. For example, if I go down south, they do not understand Hindi, and many of them do not understand even English. So I feel handicapped in that situation, but that doesn't make me disabled. It is the context, it is the environment which puts these restrictions. And if we break away these environmental barriers, people with disabilities can achieve so much and can definitely add to our GDP of the nation. Now, what do we mean by disability? How do we define disability? Now, different people will give you different definitions. But if we focus on the latest, the Rights of Persons with Disability Act, which came in 2016, how does it define disability? It says person with disability means a person with long-term physical, mental, intellectual, or sensory impairment, which in interaction with barriers hinders his full and effective participation in society equally with others. I want to draw your attention to the part which says in interaction with barriers. This is to reiterate the point I just made. It is the environmental barrier which restricts the optimum utilization of the potential of the person with disability. So the focus is in removing these barriers. And what is rehabilitation? Rehabilitation is defined by WHO as a set of interventions designed to optimize functioning and reduce disability in individuals with health conditions in interaction with their environment. So you see the understanding of focus on the environment is highlighted everywhere. It is the environment which puts these restrictions, and if those are removed and a very structured, systematic interventions are done for the people with disabilities, we can help them achieve to their optimum. I don't know why my slide change is not happening, so that's a little problematic. Sorry about this. Okay. When we talk about rehabilitation, it helps a child, an adult, or an older person to be independent as much as possible, and not just focusing on his academics, not just focusing about his employment, but also giving him the opportunity to live a full life, a life of dignity and respect, which also involves that he has a right to every opportunity of fun, every opportunity of complete life, like marriage, having children, and playing meaningful life roles. How do we ensure that a person with disability is given just the same, respect like everybody else by providing him that opportunity and not denying him of anything that we offer to other people without any disabilities? And that will be true rehabilitation. We see a shift in the paradigm if we look at the attitude of the people, but that shift is rather slow and not fully conclusive. The attitude is that of charity, what we call the charity model of disability, where people feel that, oh, so sorry for them, I feel so bad for them, so let me do some charity for them. It's my son's birthday, okay, I'm going to celebrate it by giving some, party or some food or something, some toys or whatever to children with disabilities. That is the attitude of pity, and it's not that of empathy. And this kind of attitude is further creating that rift, that divide between us and them, because we are feeling and considering them as less competent or just inferior to people who do not have a disability. But over a period of time, the attitude today should be that of human rights approach to disability, where persons with and without disabilities are part of the same society and have the same rights and same obligations. Meaning, we highlight that if we are doing something for a person with disability, it's not out of pity. It is their right. They have a right to everything that non-disabled population has a right for. So there should be equal participation, there should be no discrimination, and the state has to ensure that fair and just treatment towards people with disabilities. Even though the rights of people are put on the paper, even though we are talking about all this, but yet we see the majority of the people still having the attitude of charity towards people with disabilities. When we talk about giving them equal opportunity or rehabilitating them, the first and the foremost thing is giving them education. Educational rehabilitation will pave the base or the foundation to give them that empowered status later in life. So to give them right to education, the RTE Act is there. Even Rights for Persons with Disability Act focuses on providing education to everybody, no matter what disability they have and to what severity that disability is there. Because education is essential for the development and success of knowledge society. Access to education offers a key means to promote diversity and to create social bonds between persons with and without disabilities. When we talk about an egalitarian society, the foundation for that is education. When right from the beginning, the children learn that we are all different, we are all diverse, and they respect each other, they learn together, they grow together, that will pave the foundation of an egalitarian society. So looking at education through an inclusive lens implies a shift from seeing a child as a problem. We don't have to focus. That was the medical model where it was considered that a child or an individual with a disability has a problem and that needs to be cured. The society has no role to play in that, but that's the wrong approach. We have to shift the focus from the child, from the adult with disability to the society, that why we are creating these disabling conditions for them. Now, when we give them that opportunity, like you can see in this picture, a child on a crutch is given the opportunity to participate with other students in his class. He will not feel inferior. He feels that he's also engaged and he's doing what everybody else is doing. And the other children without disability also realize that every child can achieve what they are achieving. So that attitude of discrimination is right from the beginning. What has been observed, and this is statistically proven, research has shown that the gross enrollment ratio has reduced over a period of time. When we look at the students in earlier, younger classes, the percentage of enrollment is higher, but as they move to higher classes, the percentage, the dropout rate is much more. So if you see, by the time the students reach 11th and 12th grade, the enrollment rate is reduced to 51.3%. which was 90.7% in grade 6 and 8. Now, what could be the reason for that? This is alarming. So there is an intersection of gender, poverty, and disability. In our society, till today, we have this myth, the stereotypic attitudes associated with genders. So the girl child, if she has a disability, she's having double disadvantage. Why does a girl need to study? She should be trained in just household chores. And if it comes from a poor family, then they would rather invest whatever money they have, the financial resources they have, on a boy child, on a male child, rather than on the female child. So this intersection of having a disability, coming from poor families, and being a girl child, this intersection further reduces our enrollment rate in the school. So what do we do about that? How do we bring them back to school? Inclusive and equitable education is what is being highlighted in our National Education Policy, the new National Education Policy 2020, as well as in our RPWD Act in 2016. What does it say? A system of education wherein students with and without disability learn together. And the system of teaching and learning is suitably adapted to meet the learning needs of different types of students with disabilities. So we need to make some adaptations in our curriculum transaction, in our learning environment, in our classroom, so that every child is there and no one is left behind. And what does NEP say? It says educational equity means the educational system gives each student what he or she needs to perform at an acceptable level. It should not be such that this is my school, this is my higher educational institute, this is how I'm going to teach. If you fit into that system, wonderful. If you don't, well, I'm sorry. I'm not going to make any change. The systemic reforms are the need of the hour, where we make adaptations, we make changes to accommodate this diversity in our classroom. Onus lies on us. Now, if we want to understand the difference between equality, equity, and justice, many a times equality and equity are used interchangeably, whereas there is a fine discrimination between the two. In equality, we focus on that every opportunity is given to everyone. We have opened the doors of our schools to all the children coming from different backgrounds, not just having disability, coming from any marginalized section of the society. Education is their right, and we are opening our doors to them. So we are propagating equality. The assumption is that everyone benefits from the same support, whereas that may not be the case, as is visible in first picture. Now focus on the second picture, which talks about equity, wherein we tailor-make the education for each student according to their diversity, according to their needs. Everyone gets the support they need. They don't fit into our system. We change our system to accommodate them, to accept them, and integrate them. So this is what we mean by equity. Now, what is justice? When all can get the same opportunity, the same privileges, because the cause of the discrimination has been addressed. What is causing discrimination? If we remove that, then that is fair and that is justice. Now, that is quite utopian. Well, yes, that will take time, but that is what we have to aim at. First and foremost, what we need to address is, when we talk about equitable education, is accessibility. Are our institutes accessible physically to all our students at school level, at higher education level? If we look around, our educational institutes, are they really accessible so that a blind can access it, so that a hearing impaired can access it, so that a person who has autism can access it, or any disability? How far are we accessible as far as our curriculum is concerned? The curriculum also needs to be made accessible in a manner where it fulfills the requirement of a student with any kind of disability. See, for example, here you see tactile grounds, you see a ramp, you see railing next to that, and at different levels depending upon the height of the student. And you see the teacher teaching a child with visual impairment using hands-on hands technique, using tactile methods. And even if the resources are there, for example, there is so much of integration of technology today which will aid in the education of persons with disability, but do we have those resources available to us is what is our concern. So looking at the barriers to educational equity, first and foremost, which has been highlighted even till today, is the attitudinal barrier. We still feel, why are they here in our institute? When we have special organizations for them, special institutes for them, let them be there. And there are special educators for them. Let them handle these children. I don't have the training and I don't want them here because it means a lot of work from my side. And also there are so many stereotypic attitudes, myths attached with people with disabilities. So those attitudinal barriers, oh, he cannot achieve much. How far can he go? Why focus on his education? All these myths related to, even maybe he's paying for his past karma. We have so many such myths which come in the way of their education. Poverty, as I mentioned earlier, is one of the biggest barriers. Our states do not provide us the funds. We are still a developing nation, though we may assume that we have developed, but we are far from it. So the kind of funds allocated for persons with disability is far too less. So we are always crying poverty because our children and persons with disability mostly come from poor economic strata. So they're always craving for funds to support their education. Education is far-fetched. Many a times they cannot meet their both ends. They are going to schools because they get free midday meals. That is the level of their poverty. And how will they focus on their education? Many of our children do not have access to early childhood education and quality early childhood education. So what happens is at that time when they are at risk, if they are identified at that point of time and are given the correct interventions, disabilities can be prevented. But that is also not happening most of the times. In our schools, in our higher educational institutes, the faculty, the teachers, they are not trained in how to address these diverse students in their class. So we need a lot of capacity building. Lack of resources, as I mentioned, is one of our main concerns. Even if you go to, for example, an institute which is meant for blind, even they will not have a blind braille book for every student of their class. That is the condition we are facing. It is the reality. And in urban India, I'm not even talking about rural India right now. There is no detention policy. Now we are thinking about a change, but till now, up to 8th standard, the students with disabilities are just expected to pass. All students are just expected to pass. So other children may be able to cope, but the child with disability, when he's out from 8th standard, he's not able to cope because his foundational literacy and numeracy is 0. So how are we helping this child with no detention policy? The teachers will always tell you we have a large class size. We have 50, 60 students and more many a times. In a place like Bombay, we have up to 100 students in one classroom. So how is the teacher expected to address the needs of a child with a disability? How do we break these barriers? That is the question we have to address. NEP focuses on the underrepresented groups. Who are these underrepresented groups? They focus on gender identities, where they talk about women and transgenders. They talk about sociocultural identities, students coming from reserve category. They talk about those who come from low socioeconomic strata, could be rural, could be urban, and as well as poor people. And they focus on all 21 disabilities listed in our RPWD Act. So these are the group of students that we cannot leave behind. We have to address their needs in an inclusive classroom. It means that personal and social circumstances are not obstacles to achieving educational potential. It prohibits discrimination based on gender, socioeconomic status, cultural background, and disability. So if our NEP is giving us this mandate, if our RPWD Act is giving us this mandate, RET Act is giving this mandate to us. So how do we ensure that this is not the scenario of our classrooms? There is active participation and engagement and not just physical inclusion of students with disabilities, be it in higher education institutes or in schools. So what are the adaptations that are expected of us is the teachers have to focus on 4 C's. First is the content. What is that I'm going to teach in my class? What are the learning goals for all the students? Can I differentiate them according to the level of my students? What activities do I plan so that every student can participate in some way or the other? How can we evaluate these students? Do I have one set of, a standardized method of evaluating all students, or can I make some concessions? Can I make some changes? Can I have oral examination? Can I have multiple choice examination instead of having just long essay type answer writing? So one can be creative, one can be innovative, and one can think what are the various ways we can still check the learning outcomes of students with disabilities in our classroom. How do I make my classroom conducive? Very important that the student with a disability should have a sense of belonging in that class. Every student with and without disability, that social inclusion is integral part of inclusion. Just physical inclusion will not be. Nobody should be bullying this child. Nobody should be making him feel inferior, neither the teacher nor the peers. So as a teacher, how do I create that environment in my class? These are the things we teachers have to think about. There has to be a 3-pronged approach, where we talk about the policy of the country, we talk about human resource development, and we create this inclusive culture. If we use this 3-pronged approach, then definitely sooner or later, we will reach that utopian situation, which we are aiming to achieve. India is a policy-rich nation. I think our country has very beautifully laid out many policies, but it is the monitoring mechanism of those policies, that are those policies being effectively implemented, and are the stakeholders actually getting what the policies are talking about. So making sure of that, and capacity building is again one area where we have to focus on. How many special educators are passing out every year? How many regular education teachers are given that kind of input where they are trained to address diversity in their classrooms? So developing teachers' capacity to identify the needs of the students in the class and address those needs is something very, very important. Then creating that inclusive culture is by use of appropriate learning strategies and encouraging students to support each other. Our national education policy is focusing on building that value system, building that culture, taking us back to our roots, where competition is not what we should aim at, but collaboration and cooperation is what we should aim at. So creating that inclusive culture is very essential. In any educational institute, school or higher education, right from the time of admissions, what is our policy? Many schools have the policy where they take a test of the students and the cream of the students are only taken in. But if we have admission policy where we don't have any such system, and we say it is open to everyone, no matter what the background of the student is, we have to have a policy in place where it's a policy of non-discrimination of students coming from diverse backgrounds. NEP is talking about choice-based credit system, which will work beautifully for our students with disabilities or any other diversity. They don't have to fit into the traditional mode of curriculum. They can pick up their credits from here and there and accumulate their credits and pass out. They don't have to follow rigid, fixed systems. And as I said, examination and evaluation, we have to put a policy in place that, yes, we have to make sure that there are learning outcomes which these students have also attained. But how do we measure that? There needs to be a policy on that. Inclusive teaching pedagogy is what every teacher in higher education, in school education, needs to get trained in. Today, we talk about universal design for learning, where we talk about multiple means of representation, multiple means of engagement, multiple means of expression. These are things which every teacher, be it a regular teacher or a special teacher, needs to know that. And of course, technology integration is the need of the hour. So how can we incorporate all ICT tools and use them to the advantage of diversities in our classroom? Inclusive culture can be created only if we make everybody aware of the human rights approach to people with disabilities. You're not doing any favor to anybody. They have their right to the same education, to the same opportunity like you all have. So how do we create awareness? And that is only when we start very young, from the beginning. There is no difference between X and Y, so that when that difference is not seen, they will learn to accept everyone equally. We are part of SDG 4. We have RTE Act. We have RPWD Act. We are following Samagra Shiksha. Earlier, it was a Sarva Shiksha Abhiyan, and now we talk about Samagra Shiksha, and we have NPE 2020. They are all converging on one point. They are all converging when we talk about quality education and SDG 4. I mean, all of this is converging on one point, that no one should be left behind and everybody should be given quality education. So right from preschool to class 12 and higher education, holistic education, which focuses on overall development of a child in terms of equal opportunities for schooling and equitable learning outcomes. So how do we gear up towards providing something which we have the mandate for? Education is the first step which will lead them to employment, meaningful employment, and that will make them empowered. So if we remember these 3 E's and work on that from the very beginning of a child with disability, definitely they will achieve so much more than we can ever imagine. Thank you very much. That's my submission at this point of time. And if there are any questions, I'm open for that.
அந்த phone வேற ஆஃப் ஆயிடுச்சு என்னன்னு தெரியல.
Thank you so much, ma'am.
எந்த phone உனக்கு வந்திருக்கு?
இது அதான் இந்த phone. கொடுத்த நம்பர்.
அந்த நம்பர் தான் வந்திருக்கா?
ஆமா.
Someone's mic should be switched.
Dr. V.R. Sampath, sir, can you just move? Thank you, sir. Thank you so much. Thank you so much, ma'am, for your words.
Shweta, we can take some questions to madam.
Yes, sir. I would like to request to the participants, they may ask question by writing down in a chat box.
Before that, I had a question to madam.
Yes.
You were talking about this general enrollment ratio in the schools, which goes down. This decrease in the enrollment ratio, how much is because of disabled children? Because I believe a percentage of disabled children are less in general. Is that
Yes,
right?
yes, absolutely, absolutely. There are various reasons for that, sir. One is, as the students are given admission in the regular schools, mainstream schools, if their education is not taking them anywhere, in the sense that their needs are not being fulfilled, so they are actually at the same level as they were when they joined the school, as far as their concept attainment is concerned. So many a times when their needs are not being fulfilled, parents feel, what is the point of giving them more education? So just withdraw them and engage them in something, or just make them sit at home. Many a times children are just sitting at home. Second reason is poverty, because I do not have the resources to continue with their education. So as long as it is coming free, many a time, sir, we have seen that, as I mentioned also, it is only because you get free meals, the student is sent to the school. When that free meal service stops, the students are withdrawn and they are sitting at home. Many a times it is lack of accessibility. There are no educational institutes close by. Particularly in the case of a girl child, the parents are hesitant to send them far. So girls anyway stop going for higher education, furthering their education beyond a point. When the schools are nearby, they allow them. So these are some of the common reasons because of which the enrollment is decreasing, particularly for students with disabilities.
In general, do we have a data on how much, I mean, in terms of percentage, so if we take the children, disabled children form how much percentage in general in the population?
It's about 11 million, but I could be wrong, and the statistics is not so good, but it is around 11 million, but I could just check and confirm.
Okay. And amongst the major barriers for education, like you had listed many things, then in terms of facilities, in terms of availability of teachers, especially in rural areas, even in urban areas, in some of the schools, is economics a major problem for us in educating our children?
According to me, sir, my experience tells me it is the attitude. The first and the foremost barrier is that of attitude at administrative level, at our government level, at every step, and even amongst the teachers. Because of that, we are not able to bring in systemic reforms. If the principal of an organization does not believe in inclusive education, he will not spend the money that is required to bring in the resources for teaching this child. Now, the Supreme Court has come out with this order that every school must have at least 2 special educators. But how many schools actually have 2 special educators? They do not have even 1 special educator.
Yeah, that's what we see. Yeah.
So 1 special educator is supposed to be catering to, say, about 15 schools. There may be, say, about 40 children. So a child does not get a chance to be with the special educator on everyday basis. He may be seeing the special educator once in a fortnight, once in a month, sometimes once in 2 months, and maybe more. So the class teacher is not really equipped to deal with that diversity, and they also do not feel that it's my responsibility. So whenever this special educator comes, That's when this child gets some input. Otherwise, he's just sitting in the school. He's just there. So attitude where the teacher does not take the responsibility, okay, let me, connect with the special educator and ask her, what can I do with this child when you are not there?
Yeah.
They don't even treat the special educators equally. They're, them. Special educator and special child is a different
Category of it.
category altogether.
Yeah.
Yes. So that collaboration is something very important, and that's again stemming from attitudinal barrier. But if the management believes in it, then definitely you'll see a very different scenario in those schools. Because there are good examples also where we see inclusive education happening beautifully. But and there I will pinpoint that it is the management, then they will be always after their teachers, we have to do it and you tell me how we can do it and I'm there to support you.
Yeah, maybe in general, even the social attitude needs to improve about
Absolutely.
in our
Awareness, because general people are not affected by people with disabilities, not in my family, not in my immediate family. So, it's somebody, and like, why do I even bother to think about them? It's not in my scheme of things. So to make disability a part of our life, earlier, even to wear glasses was a taboo. A girl with the glasses was like, oh, chishmish. Similarly, when we have like a Barbie doll on a wheelchair, it becomes part of the system. So we have to demystify disabilities and we have to internalize and make it a part of life. Like we see many developed nations, people don't raise their eyebrows. They don't live this life of, you walk around and people are looking at you like that. No, they're just like us. So they are at the beach, they are at any, bar or anywhere. So they are living full life. That is again because of lack of awareness. People many times are hesitant that we don't know. They do it out of goodwill that, okay, I'll celebrate my son's birthday by giving food. But that is not what they want. So, but they feel maybe that's the way they can help. So we can't blame the people who are doing that. It's lack of awareness.
Yeah, I agree. Any questions, Dr. Shweta?
Yes, sir. There's a question from Mayank Tiwari. Can customized teaching help in it?
Yes. When I talked about, once again, when I talked about universal design of learning, that is what is being used today for addressing all diversity. See, NEP 2020 does not only talk about children with disability. They talk about all socially and economically disadvantaged group, underrepresented group, the group of students who are marginalized due to various reasons, and disability is one of those things. So to address those diversities, and also, as I just said, we have to demystify disability. Just look at the limitations a particular disability or diversity imposes on a student. So when we use this UDL, Universal Design for Learning, research has proven that it will address all diversities in the class. So we are representing the information, the content, keeping in mind multiple intelligences of the students, multiple interests of the students. We are representing in different forms, different sensory forms, and also allowing them to get engaged in different ways, also evaluate them in different ways. And that is definitely going to help our students with disability as well. So we need to train our teachers how to use this effectively, even at higher education level, not just in school education.
Okay, there are many questions, ma'am. I think we should invite our second speaker, Dr. S.Z. Zaidi. We'll take a question after the session.
Okay.
Yeah. Thank you so much, ma'am, for your words of wisdom and orientation regarding exploring new paradigm for supporting and creating environment for differentially abled person by giving equal opportunity. Thank you, ma'am, once again. Now, I would like to request Dr. S.Z.H. Zaidi to enlighten all of us with your wisdom words. Over to you, sir.
Thank you very much, Dr. Guru Prasad sir and Madam Sujata. It was an extremely informative and very, very effective and powerful presentation. Now, as she has rightly said, today is the 3rd of December and Day for the Disabled Persons. So even I thought of discussing something associated with them, particularly in terms of their mental health issues and how to handle and how to address and what are the things which we should do it. So let me first share my PPT, if I hope it's okay. Is it visible to you all?
Yes, sir.
Then thereafter, I have to make it into the presentation mode. And design. How to go for presentation mode? This yes.
Have to share the screen.
Yes, sir. That is there. Go on the top.
Yes, yes. Is okay?
Yes, yes, yes.
Well, the topic of my presentation is the mental health issues of persons with disabilities and old age persons. Basically, for the persons with disabilities, you know that this is one of the very peculiar and very important, significant turn of the life. Whether it is inborn problems or it is acquired at any stage, but it definitely changed the whole scenario. So to understand that what is associated with this and how everything is caused by, let me first explain in a very simple way that how WHO has defined disability. Particularly, I'm addressing to the students because I'm told that number of students would be attending this program and not for the senior person like Professor Guru Prasad or the Sujata and other senior faculty. It's basically for those who are young and budding and our future professionals. So you see that there are two very important things which takes place. One is impairment. Impairment may be because of any reason. And functional limitations. Say, for example, if impairment is not on the part which had been responsible for our quality of life, our day-to-day activities, the functional limitation would be comparatively less and the resultant problem would be comparatively less perceived. But if it is on the very vital part of our body, say for example, I'm a teacher, I write, I have to use day and night my activity right hand and less comparatively left hand. So if there is any impairment in the right hand, my functional limitation would be so acute that even my everyday activity would be impaired and my reactions to this impairment would be very serious. And if it is the left arms, it would be comparatively less. So this impairment may be in both the faculties, physical faculties like deficiency, disease, trauma, old age, impairment, or mental processing, mental faculty, retardations, chronic psychiatric illness, degenerative conditions, etc. So the disability may be the locomotor, sensory. Locomotor involves orthopedic or cerebral palsy or leprosy related issues, sensory, visual motor, visual hearing impairment. Here is cognitive impairment, which is very, very limiting and creating a lot of functional limitation, that is mental retardation and mental impairment. Dementia associated with the old age. Many of persons are now realizing that our old age, one of the very common issue, mental health issue of old age related to the dementia and other conditions. Other conditions like multiple disabilities, psychiatric disability, learning disability, and other 21 such disabilities which have been recorded and included in the Right for Person with Disability Act. And interesting enough, that some of the disability is a visible disability that anybody can see, anybody can support, anybody will come forward to help you out and realize your conditions and realize your mental status and your inner feeling about, but many of them are non-visible, which neither you are disclosing this thing nor the person are aware of it. And the result is very, very negative, very damaging, because nobody is realizing that you are not understanding the things because of old age processing, or you're not recalling it and not remembering, but you are expected to recall it. You are expected to listen at every pitch, but there is a hard of hearing or your vision is impairing. So the expectation of the society, expectation of the employer and the people or relatives would remain the same, but there is impairment and there is a functional loss. So this non-visible disability and non-visible limitations are really very challenging and require very special attention to the problem. Functional limitation may be partial, could be total. And it could be permanent, it could be temporary. If it is partial and temporary, there is not a serious reactions to your understanding and adjustment process of your mental well-being. But if it is moderately high or total, and it is a permanent, non-reversible, and you are aware of it, that it's non-reversible, stroke, particularly if it is a hemiplegia, paraplegia, it is almost non-reversible and it has taken place. So you can visualize the psychiatric reactions or psychological reactions to the situation. And this can be distributed in a mild, moderate, severe, and profound as per the Disability Act and other government instructions. Less than 40 is not a problem, and more than 40 it is a moderate, and 75 it is severe, and profound is 100%. Though we say that mild less than 40 is not a problem, but my personal experience dealing with these situations are the borderline cases are equally very serious issues, and their adjustment process is very difficult because they are neither of this category, neither of that category, neither they are not enjoying exactly availing the facilities of given to them, or nor he's competent enough or strong enough or able enough to make out their own independently, and they are not within the range of consideration. So it is just like any borderline case. 40% is the passing out marks. If you have received 3.39.99, you are failed. And that the turmoil of the person who failed with the 10% marks only are much severe than the one who has passed on the very borderline conditions. It is more frustrating. Now, what WHO, that's a very popular definition of WHO, nothing to repeat it much. Health is the state of complete physical, mental, and social well-being, and not merely the absence of infirmity or disease. It is focused on mental and social well-being. But in our system, it is a spiritual well-being as well. It is because we are basically a person of having a lot of spiritual faith and religious faith and belongingness and all these things. So if we are physically fit, we are mentally fit as interacting with people, but we are not very sure that in spite of doing all these prayers and puja and namaz and roza and sacrifices, whether God is also happy with us or not. And that is continuous worrying process. And we try to interpret it, every happening in our life with the mercy and the happiness and the agreement of the issues, and the spiritual issues are always interpreted. We try to interpret happenings through the spiritual chashma, through the spiritual glasses, and that sometimes makes a person very upset. Specifically, WHO has defined mental health also. It is a psychological condition of mind, the state of emotional and social well-being in which the individual can cope with the normal stress of life and achieve his potentials that include being able to work productivity and contribute to society. Here are three things are very, very important. First of all, that it is emotional and social well-being in which individual can cope up with the normal stresses. Now, here is a very big questions I'm addressing to my students because we have a very well-established parameters for our physical conditions. Height should be this much, age, as per age, the weight should be this much, as per the gender, this thing should be, and everybody knows that what is the normal blood pressure and what is the normal heart rate and oxygen. Nowadays, after COVID, we have also learned that how much the saturation point should be there and oxygen and inhale of oxygens, sugar level, and every parameter is well defined. But WHO says that the person should have a normal stress, ability to stress normal stress. So what is the normalcy of stress? That may vary from person to person. To me, anything could be very stressful. Losing a pen, which you have been considering as a lucky charm, that if you write for that pen, would definitely be helpful in achieving your good marks because you have a full faith into this. But for others, it's a matter of joke only, that why you are after that pen, you can take any pen and write about it with any pen. So the ability to cope with the normal functioning, normal stress. So I will tell you that the one very landmark understanding of normal stress is any stress which is not coming on your way to maintain your happiness, are coming on your way to functional limitations, are not causing your productivity in the negative way, not reducing your productivity, not creating any disturbance and barrier in your social interactions, your personal activities. So these are the, and if it is causing any hindrance in your functional ability every day, it means that your stress is increasing, and it is increasing to the extent that you need some intervention, psychological intervention. Now come to my second slides when I said that impairment leads to functional limitations. And I gave the example, if you're right-handed, amputation of right hand would be more severe than the left hand. And if you are left-handed, reverse to that life, amputation of right hand has no meaning for you to that extent. So in that case, your stress would vary from your impairment on your body part and what particular organ is involved. And hence this functional limitation would be accordingly. And hence the reaction would be accordingly. Now, let me say one thing very clearly, because out of my own experience, that way back, about two decades, 3 decades back, we were having a conference in IIT Roorkee, and there was presentation similar to this, that mental health issues, adjustment issues to the person with disability, and there were number of disabled person attending the things. So they thought, they have reacted to this, and they said that, do you think that all the physically handicapped person are mentally sick as well? And there was a real discussion on this. And thereafter, I am very consciously presenting this slide whenever I have to speak on this. And it is a disclaimer as well as disability is a strong stressor, severity of reaction depending upon various conditions, and it is not at all a mental illness by its own way. So this is one thing which is very clear. Disability is a strong stressor. Severity of reactions depends upon predisposition of the case. Everybody would not react to all type of stresses uniformly. It is your predisposition. Predisposition means your physical and mental makeup, your genetic factors, your rearing and and development practice, how parenting has been done to you, how dependent and independent you have been from the very beginning, and how much stressful experience you have cope up, and how much you are physically ready to do it. So it is predisposition, which is very important. Number two, age of the individual. At what age? The studies suggest that if it is on the early stage, person can adjust fairly well. There are many persons who have never seen the world at all, particularly if they are congenitally blind. For them, losing a vision has no meaning because they have never seen the time. But if you have already seen the world, you already started your establishment, you are already working at a very high level. And if you lose your organs, if you lose anything, if there is any impairment at that stage, late onset disability, it is very challenging and difficult to adjust with that situation. A stage of life, age of onset, at what stage? It is in the prime stage or it is already a senior levels, and though it is everybody is important, his age is very, very important, but the reactivity would be very varying from age to age. If he is a youth person, the whole career is left out, whole family is yet to be settled down, and children are small and all these things. Any serious disability at that stage would be taken a different way as a person of very advanced age, having completed all his responsibility and all this thing. If he loses his vision, which is very common, that myopia and the cataract and all these things, for him, it is manageable, it is adjustable. But if a person of young age who is a surgeon or who is based, his profession is based on the visual acuity, and if he is losing the vision, the reaction would be altogether different. Faculty involved, what type of things, what are your abilities involved, and degree of functional limitations. I've already introduced that it could be partial, this could be moderate, this could be severe. So obviously, if there's severe disability, moderate disability, and your resilience level is comparatively less, your predisposition factors is very high risk, put you in the high risk, then the severity would be much more than the one who has a strong resilience and the risk factor is comparatively less. Pre-morbid adjustment stress coping skill, I've already explained this thing. Family support and social integration. Sujata ma'am was talking about the social integration and community support. There are some persons who are very in disadvantaged stage where neither their family are in position to support them, nor there is a very strong program or community-based support. So for them, having even the comparatively less severe disability would cause much more than the person who has very strong family background and financial support and very so much facilities available and automatic gadgets and lifestyle is different. So family support and social financial condition, obviously I've already occupational and employment conditions. I've already given the example, if there is someone who is a surgeon, but if he gets problem with the tremors in hand, for a surgeon, if tremor has taken place, this career is different. But for the physician, if tremors takes place, comparatively he is less affected because there is nothing much to do except examination of the body and pulse rate and writing the prescriptions, which he can always do by dictation and take and involve somebody to give the feedback for the information, what are the findings along with the case, but he can always think it. But surgeon means doing something by himself. So the occupation and the employment conditions, if it is a contractual employment, which is nowadays a very, very popular way, where there is a social security and the employment security is linked directly with your physical health, physical fitness, and the productivity. If you loses anything, if you meeting with the accident or if you are interacting with any such situation, your severity of problem would be very strong and the reaction would be very serious. accessibility to social security scheme. How much social security scheme is available to you? There are so many schemes. As my previous speaker said, that India is a place of very, very good policies. So our social security schemes are also very, very attractive. Quantum of money, 300 rupees scholarship or 300 rupees pensions given to a person with disability or old age person who may not have anyone to take care of. How much security a person may get out of it. So accessibility to social security and to get it, that itself is a very major issue. Now, which is the main point of my discussion so far, अभी तक मैं आपसे सिर्फ एक भूमिका बता रहा था कि what are the conditions. Based on number of research studies, I have pointed out, and based on my personal experience practicing in the sector for last 40 years, 44 years, what are the common things, common manifestation of features with person of varied severe disability are being showing, and which may require, in addition to what inclusive education or physical or fitment of the appliances and employment are concerned. What physical fitness, in addition to physical fitness, what mental issues are there and which might be addressed, which have to be addressed to make the person more resuming the back to the normal life and more rehabilitation results. One is anxiety. Anxiety is very obvious, but anxiety is not as a perpetual problem. Panic disorders, they go for showing the features resembling to the panic disorder that is episodic as well. It's not only the perpetual anxiety, which mild घबराहट or उलझन or परेशानी or palpitation is not that. The difference between anxiety and panic is when it is a severe and the person is disorganized, he loses his entire personal and social judgments. So at times, disabled persons of different variety, different categories and different severity have been showing panic disorder as well. And that requires phobia, social phobia and occupational phobia particularly. Social phobia means when you feel inconvenience, fear of having, interacting, appearing in social setup, social situations, where you have to meet, you have to talk to some stranger. If the person to whom you are going to meet is your friend and your relative or a common face, you may not feel bad about it. But if you are going to have a stranger and you have some disability which is quite obvious and is visible disability, many times people may not feel comfortable and may require special attention to handle the situation. Occupational phobia. One of his colleague has lost his finger because it was chopped by under a machine, and he's also a machine man. He has developed a phobia because he may not chop his own finger, so his productivity is reduced, his sincerity and his commitment is now reducing, not because he is no more a good employee, he is no more a good sincere person for them, for the employment, but his occupational phobia, and he is worried about that he may not lose his second hands also, the finger of another hand also, so it is there. Obsessive compulsive disorder. I'm not talking about what obsessive compulsive disorder or anxiety are all about. I'm saying that what are the chances, what are the for what these cases are of high risk. Obsessed with distressing thoughts all the time and repetitive attempt to elevate performance. They will keep on doing to elevate the performance because they are quite concerned that this has happened. They are slightly different. People might be thinking about it. They are preoccupied, they are concerned, they are obsessed with the thought that you might be taking him as inferior. Even if you may not be thinking, even if you are quite convinced that this person, in spite of his disability, is a good mechanic, he is a good person, he is a good officer, he is a good student, but he himself is not very convinced. And he is obsessed with his limitations, and he is continuously trying to elevate his performance, for which he is stressed, for which he is anxious, for which he is irritated many a time. Post-traumatic stress disorder. Psychology students, psychologists are fully aware that once you have undergone some trauma, you have exposed to that trauma, thereafter, sometime for a quite longer period, you are continuous that the trauma is over. You met with an accident, you have been fully recovered out of this. You got your money back from the life insurance for the insurance company for your vehicle which was totally broken. Still, you get the flashback that what has happened. You get emotionally detachment that what is the life, why should I, it was just a matter of chance I could say, but there was no hope of my survival. And jumpiness means that you are restless, you are not concentrating on anything, and it is reflecting to your everyday activity for which you have passed through, and that trauma, post-traumatic stress disorder is one thing for which person with disability, particularly if it is amputee or if he has lost his any organs, is very susceptible to that. Depressive disorders, not exactly with the free and frank case of all the features of depression, but dysthenia, low-grade moods and continuous anxious anxiety. And hedonia means when they are not feeling happy to enjoy, when they cannot enjoy, not enjoying the otherwise things which is the colleagues and other people are enjoying, particularly in the old age process. Old age process in hedonia starts slowly, but it reaches to the extent that when the person feel preferring living alone and they are not feeling comfortable in the group activity and the playing with the children and enjoying the interaction of, they feel irritation if there is a noise and a lot of excitement and loss of activity into this, because comprehension is an issue, the dementia is increasing and the person is feeling discomfortable in group activity. Many cases, some psychotic reactions are also reported, also seen. You know the difference between neurotic and psychotic, and not to explain it further. Where vague paranoid ideation, it is not paranoid delusions. Mind it, there is a difference between delusion and ideation. Ideation means that I am thinking he may not be, but he may be, but I continuously am thinking that he might harm me. And the delusion means I am 100% sure he is after my life and he is likely to harm me. His only preoccupation is to kill me, to destroy my property, to spoil my career and all this thing. That is the delusion when there is a firmness is there. But ideation means that he might, I'm at high risk, he may not be very helping to me and he may be against my intentions. So this vague paranoid ideation is seen in many cases, particularly if the disability is late onset, if the vision is lost and he is not seeing around you, and that is very common also. Anybody will feel it. We whenever we go, we are quite vigilant to our environment that is coming from, where I'm coming, which traffic is coming from backside, and to whom I'm interacting, what is the area and all this thing. And if you close your eyes and move, you will feel very insecure. But here in this case, you will not feel that somebody will intentionally harm you. But if this idea starts coming that people might harm you because of you are at the disadvantaged condition, your vision is low, you cannot hear things. So it is alarming sign, and these persons are at high risk. Again, I am saying that they are not paranoid psychotic, but they are high risk persons. Their situation is such that they may feel, and that require continuous support in the process of rehabilitation. Negative symptoms include social isolations, withdrawal, and loss of motivation. Why should I do what is left out in my life? Better I should be left alone. And social isolation is something which is seen in late onset persons. And in fact, late onset persons को ही ज्यादा psychiatric support या clinical psychological support की आवश्यकता होती है, because the one who is from the childhood or from the congenital status, they are fairly well settled down. Behavioral problem associated with low IQ. Sometimes we do not realize that the person is behaving in school, normal schools and the mohalla and all to here and there. He is behaving in such a way, and that is not because of his intention or he is a bad character person or he is basically a bad person, but because his understanding, his comprehension of situation and his understanding of the consequences of his behavior is low, his personal and social judgment is impaired. That is why he is behaving in such a way, and he might require interventional support if his borderline intelligence or his low IQ persons. And drug abuse is another problematic issues which are being reported by a different type of persons with disability, particularly if morphine addictions and all these things, if there was amputation, if there was a major surgery and the morphine was given for the pain relieving, so he's depending on that and he's using as a crutches that unless I take morphine, unless I take this and that, I cannot function, I cannot get relief of it. So this now impact on education, vocational training and income generating activities. Why I have chosen this particular area today, because when we talk about disabled persons, we have to see all the three impact: their education point of view, which Sujata ma'am has very rightly mentioned, their vocational training and their income generating activities, depending upon the severity of basic personality manifestation. That holds good for everybody. But the nature of training and employment and sensitivity to the training administrator and employer, how sensitive your employer and your training administrator are, how much he understands your limitation and your efforts, whether it is helpless situation or it is intentional situations. Whether in spite of all limitation, he is trying to put up his best or he is avoiding or he is making use of it. There are many persons who try to encash, there is a compensation neurosis, well established condition when the person is getting some relief for injuring himself. So not very keen to come back to the job and come back to the same situation because he is feeling comfortable in living in that state. So what are the secondary gain? Why his person is behaving such a way? So all these things require sensitivity of your training institutes, training administrators, and the employers. And if he is sensitive enough, if he is supportive enough, if he is positive enough, your stress would be reduced. And in spite of disability, at work or anywhere, your adjustment process would be improved and you will feel comparatively relieved. Moderate to severe degree of manifestation may cause interruption in education, training, delay or dropouts, irregular attendance, poor productivity, low rating from their employers. Last point is very important, where I mentioned where non-disclosure of psychiatric problem leads to prolonged stress. Sometimes we try to hide our limitations, whether it is vision, that it is hearing impairment, or it is the psychiatric problems, that I have certain doubts about the things. I get anxiety. I remain very, very conscious about it. And that is why I am not working as per your direction, because I don't know your intention. I don't know your motivation. And that is why I'm avoiding. And he is not disclosing this thing, that he is slightly suspicious about the things. And that is leading to conflicts between employer and employers. And it is stressful because it is prolonged things. It is not that only one day I have developed this idea. other day it's okay. So it is no disclosure of psychiatric problem leads to prolonged stress. For both, employer is also understanding that the employee is having some unusual thinking process. His perception, he always interpreted things in different way, which may not be correct, but he cannot say this thing because he has no proof to it. And vice versa. The employee is also not disclosing that, yes, I am slightly having a different thought process. I am having some simpler, different way of doing. And this might lead to a stressful situation for a longer period. Accident proneness to side effect of the drugs. This is again important thing which requires management, especially if the person having prolonged treatment or a psychiatrically chronically ill person are given the jobs for that. Drowsiness. Many drugs are producing drowsiness and dizziness and restlessness, headache, shakiness, confusion, and weight gain. These things are the byproduct of many medical treatment which are given to persons due to disability conditions or other severe chronic condition or illness, medical condition, all these things, and that might lead to continuous accident proneness or makes a person more accident proneness and not very comfortable, not very welcome in the job floor, and that might lead to again mental health reactions. Management to start with assessment of severity of problem is very, very important, particularly cognitive status and societal risk. There are cases when the late onset, they have attempted, they are preoccupied, and they are high risk cases. Family support, how much it is there and how it could be handled. Minor problems are self-limiting. Self-limiting means that where you need not to have any intensive treatment, or you may not be even consulting psychiatrist or clinical psychologist. It would be self-limiting, might like irritation, impatient, preoccupation with the law, something disturbed sleep, avoiding social interaction, etc. If it is there, nothing much to bother about. It would be self-limiting. However, if it is persisting for more than a week or 10 days, 15 days, then it might require, or the frequency, it is coming, going, disturb sleep. For 5 days, 10 days, he is not getting proper sleep. Then automatically the spontaneous recovery has taken place. He is sleeping again after 10 days, 15 days. Similar issues is there. He is preoccupied. He is avoiding social interactions. So if these things are there perpetually maintaining, then you might take this case for the professional consultation. Otherwise, these are the minor issues which is self-limiting. Irritation is the outcome of the present lifestyle. Impatient, that is the biggest problem with us, that we need everything then and there, right now, here and now, which is not a specific problem related to any particular conditions, particularly the disability condition. It's not that. Major problems need psychiatric support like crisis interventions, sudden loss of vision, amputation, stroke, birth of a CP child. Definitely, it may require immediate psychiatric support. Individual counseling to strengthen defenses and cognition, family counseling, application of behavior modification, and sex and marital counseling is very important. If a young person has lost lower limbs, or he has become paraplegic, where both the spinal injuries and all these things, what are the counseling, what are the informations and the way of doing and satisfying their sex life now with this limitation? So that also require, and that will make his personal life slightly different. counseling, yoga, awareness about social security schemes, and effective, prolonged, appropriate medication by a specialist. It's not that anybody can handle, anybody can be treated, anybody can be consulted. Need to promote mental health among persons with disability and old age. Mental health, quality of life has a direct relevance, help the adjustment with social disability, and mental health can influence progression, outcome of the rehabilitation efforts, sustainability. If we are taking care of the mental health, be sure, and I can assure you, the entire rehabilitation support would give much better. Your educational support would give much more better result than if you'll ignore this important component. Role of public health practitioners in promoting mental health to persons with disability. Identify high risk factors, increase awareness about mental discomfort, remove the stigma associated with mental disorder is very important. Even for education, Sujata ma'am has said that it is the mental barriers, it is psychological barrier, it is social barriers, which is more limiting than the disability itself. We are willing to disclose anything to the physicians, but not at all willing to disclose how we are feeling from within. What is our mental process? What are my stresses? Everyone has one family physician, not only physician, family gynecologist, family pathologist, family tailor, family cook, and that is coming from stages to stages. My grandfather used to get the stitch his clothes from the same tailor. My children are doing, myself and everything. Everybody has a family association, but not a counselor. Even Vakil Saab is the family Vakil who knows your property, who knows your in and out, and who knows your things, and he can take care of your legal issues. But there is no provision of family counselor, and there is no provision of handling, talking about mental issues openly, and we hide it. So it is not only, though I started saying with limitations are disabled persons, but these facts are with everyone. With this, thank you very much. I think that I tried to explain something about, and that time is also exactly how much time I was given to me.
Thank you so much, sir, for giving orienting various problems, for giving orientation about various problems and problems associated challenges confronted by person with disability and the role of public health practitioners. Now, I would like to request to audience and the participants, if you have any questions, you may ask by writing down in the question answer box. We do have certain questions, sir, respected sir and ma'am. So we would like to proceed with the question answers.
Yes, most welcome.
Yeah. Sir and ma'am, there's one question. What is more important is to achieve equality, equity, or justice, although three of them are equally important.
Madam is here or not? Make sure.
So she had to leave early, so she
Yeah, I think
left a message and.
yeah, I think we don't take questions to madam then.
Okay, sir. Sure, sir. So would you like to answer this question, Dr. Zaidi?
What are the three things he asked?
Achieve equality, equity, and or justice.
Well, all the three things are interrelated. You delete one thing, you cannot achieve the second thing. So it is all interrelated. Justice, unless you have the justice, you cannot ensure the equality or equity. So if equity is there and equality is there, and you do not pronounce justice, for you show me the face, I'll tell you the rules. If that is the policy, so the first two things has no meaning. So all the three things are equally important for everyone, for everyone. It's not only for the diverse population or a special population, it is for everyone. And our constitution is ensuring this thing. How far we are implementing that may be debated, but it is already there in the constitution.
Thank you so much, sir. There's another question. Some people prefer to use the term physically challenged instead of disabled. What are your views about it?
Well, this is an older argument and old story, and it is a settled issue that no one is absolutely fit, and there is nothing like normal conditionings. Everyone, I am putting my chashma, you remove my chashma, and it's totally physically disabled person. I cannot do it. I cannot work it. And I need a special thing, that is my chashma. So the better to say the person with the special needs, and that would cover everyone. You ask me to write and don't provide me the pen. So my demand of asking you the pen is not injustice, and you cannot call me disabled or especially challenge and all these things. It's basic need which is required.
Thank you, sir. There's one question. How does one get rid of fear that triggers and affect one's life in so many ways?
क्या चीज मैं समझा नहीं, क्या question is it?
How does one get rid of fears that triggers and affect one's life in many ways?
Where the treatment of fear, anxiety is an established process, and that is systematic desensitizations to the counseling and so many things. It is depending upon the individual case to case. We have to analyze, we have to assess that how far severe anxiety, because one cannot think a person without anxiety, and mild anxiety improves yourself. To keep yourself on the track, it is a good thing that you should have anxiety, but it should be the mild. However, if it is increasing to the converting into the panic or severe condition, which might disorganize your performance, that becomes problematic. Otherwise, a human would have anxiety. Only a person who is standing on the statue on the road, पत्थर का आदमी, उसको anxiety नहीं है कि बारिश होने वाली है या धूप आने वाली है या तूफान आने वाला है. If you have reactions to this, it means that you are reacting to the environment very well. But to what extent, the severity of reaction will decide that whether you need treatment or not, whether you need some support or not, and that will depend upon person to person, individual to individual, which start with the assessment of severity of anxiety, might take care by only psychoeducation, or may require some intervention through different techniques, procedures.
Okay, sir. So there's a question from Aradhna Kaul. Is it possible to recover from PTSD entirely?
Time is the best healer. Yes, if it is. But if the symptoms are severe in between, mild medications, mild interventions, psychotherapy, and all this thing, behavior modification, all this thing may help you out. But if it is mild, not causing your day-to-day activities and not impairing your functional ability, nothing to worry about. It will be vanished by its own way. It will continue for some time. But depending upon, you see that the biggest parameter is that whether it is causing impairment in your day-to-day functioning. And I can tell you few indicators. If I can take few more time, so Shubhi, do I have time? Sir, Dr. Guru Prasad, can I take?
Yes, sir, please go ahead. Please go ahead.
Yes. Well, I can tell you few, not for anxiety, for every stress, whether it is causing, because in the beginning I said that that's the normal stress. So what is the criteria of normalcy of stress? The one is that if you are doing well means that whatever work you were doing, whatever assignment you had, whether if you are a student, you are studying well, if you are a teacher, you are teaching well, if you are administrator, you are taking care of taking decision, all these things. If you are doing well, if you are housewife, you are working and getting satisfaction out of it. So if you are doing well and getting satisfaction, that is one criteria. Meeting well means interacting with the people. Your social interaction is continuing. You are not isolating. You are not withdrawing. Sleeping well. If you are sleeping properly 7-8 hours, which has been your pattern, and that's the pattern which have been from the very beginning. There are some people who do not get sleep or who are not getting time to sleep more than 6 hours, 7 hours. So for them, it's not that, and it's not a situational. कि आपका जब बिस्तर चेंज हो गया या कमरा चेंज हो जाता है तो 1-2 दिन आपको नींद नहीं आती. So not for that particular things. If you are not sleeping well properly, it means that is an early indicator that your stress is now causing your things that is going beyond that. If you are not eating well, meeting well and eating well because if your appetite is impaired and everything is not situational, that for a day or two, if it has become the pattern for a couple of days, that you are not getting, because कहते हैं ना कि अगर मन अच्छा तो जग अच्छा. We say that if you are not feeling good, you don't feel like eating. You don't feel like eating. If you're not feeling good, you are not getting taste to otherwise a good food. So if you are not eating well, and if you are not mating well, mating means sexual activity. It's not exactly the sexual intensive sexual activity, but your desires to having sex. If you are not mating well, you are not having the desires to sex for any couple of days. And again, it is, if you are very tired, you may not have a good sex performance. If you are not tired, you have everything, but still you are not getting pleasures, you're not getting impulses, you're not visualizing, you're not getting sensitivity to your sex organs and all these things. It means that something very unusual and your stress is causing you, leading to the place where you have to consult people. So what are the things? Doing well, sleeping well. Doing well, anybody can, you may have some problem one day, or आपका concentration नहीं हो पा रहा है, या you are so much excited or so much depressed or for anything. So it is quite obvious that you may not perform as well as you have been doing till yesterday, but it should not be perpetual status. If not doing well, not meeting well, not eating well, not sleeping well, not mating well. If these are some of the parameters, if it is disturbing you, it shows that you are not in the bearable stress. Your level of stress is increasing and you might require some support. Is that okay?
Thank you, sir. So next question is on social rehabilitation.
Yes.
Gautam, we would like to know your views about social rehabilitation.
You see that life has 4 very important components. As the life, L-I-F-E, life. The same way life has 4 components. One is the physical component. Another is psychological component. Third is social component. And fourth has economical component. And for a person with disability, you have to give support from totality. If one has lost the lower leg, amputee, you have to take care of his physical requirement first. You have to treat him. You have to give the surgery, treatment of the appliances and all these things. That is one part of it. The second is that now he is a person with artificial limbs. The confidence level, the self-image, the self-realization would impair very severely. So you have to give him support to rebuild him psychologically. And thereafter, acceptance of society. That is social rehabilitation aspects. Acceptance society, because society is still believing survival of fittest, and he is no more as fit as he was there. So the setback, he is likely to be isolated. Who will take a totally blind person on a project which requires very, very speed and requirement, unless he is very sure about that, yes, in spite of his limitations, he would be equally independent, equally competent, equally support to us. So it's likely to be kept on isolation. So social rehabilitation includes when you ensure acceptance in whatever way the person is. Society and community is supporting, community is accepting him. In many cases, unfortunately, if the child is mentally retarded, the family are left isolated. They are not interacting. They are not visiting the place. Very difficult to get the proposal, marriage proposal and all this thing if you have some disabled person. And our in Indian setup, unfortunately, it is said that when you go to the morning anywhere, proceeding for a very important job, if you have seen any lame or blind person or any unusual person, rest assured your work would not be there. So with this cognitive status, with this cognitive thought process, no matter how well you are treating, how well you are providing support, unless you change these attitudes, you change the mindset of your society, the disabled person will not be acceptable. So this is social rehabilitation. And of course, the last one was, I said, is a vocational rehabilitation. Whole thing is that, bhaiya, sabse bada rupaiya. Unless the person is continuously earning, if he is contributing to the economy, you have to make him contribute and not only the consumers. So if all this thing is given, so it is integrated support where the physical, psychological, social and vocational services and support inputs are available, then this limitations of disability would be felt comparatively less. I am not saying uska dusra पैर निकल आएगा, but uska एहसास कम हो जाएगा. You can definitely assure reducing the ehsas of disability than the disability itself, and that would be the great support to the services to the person. Any other question?
Yeah, thank you, sir. The coming is a question as well as a suggestion also, which I seems to. Can we boost importance and the need of mental health care by discussing and involving it in different kinds of cultures?
Yes,
like
of course.
using of the social medias and
Yes, of course. Mental health should be discussed in every platform. Should be discussed in every platform and very openly. Let's talk about mental health very openly. This is what I've said, that we are willing to share any damn thing to anybody, but will not say that how I'm feeling from within. पैर की उंगली से लेके और सर तक सारे शरीर के सारे हिस्सों में दर्द हो रहा है, कुछ exaggerated, कुछ perceived, कुछ this and that you will share with anybody. You will start the discussion कि आजकल बड़ी कमजोरी लग रही. How are you? Not feeling well. Just ठीक है. Not keeping well. All the time feeling tired, fatigue. But nobody will say that all the time I'm feeling very, very scared from within. I'm feeling that my boss is not very congenial and his way of doing, and I don't feel like interacting with him. I have suspicion about my wife and all this. Nobody will talk about it, and there is no platform to share this thing with the safe arena. Safe arena means where the confidentiality is maintained. So this is something very peculiar that is very much required.
thank you, sir. For this session, might be a last question, but I guess with the numbers of questions have been answered for the audience. Up to what extent the need of the mental health care will rise in our country?
Well, the country is progressing, so our requirement is progressing, so our stresses is progressing. We say that about tension. I take it in a positive way. I take in a positive way in such a way that our ambition is increasing, our targets are increasing, and so the anxiety of achieving the target has to be increased. If we have to progress, if we have to be at par to any other country, we have to be very alert, and that is the stress is the byproduct of our system, byproduct of our community, and byproduct of our economy. But we should have sufficient facility to handle it. It is that we have to organize. So anxiety and stress and tension, so-called the very common word tension would be there, it would increase. But we should have very effective way of addressing this, and for which last couple of years, say about 7, 8, 10 days, the government and NGOs and other initiatives are.
1:30 बजे से इस सागा है, 2 बजे से दूसरा हमारे
Please close your. So it is also increasing, but definitely considering the size of the population and the manpower available in India particularly, there is no match. There is no match. After COVID-19, fortunately, only 4 or 5% population was suffering from the active COVID symptoms, but 100% with the psychological reaction to the COVID. 100% population was suffering from the psychological reactions of the COVID. And that would continue. It's not that is being winding up. Symptoms of COVID has been reduced, has been discontinued, thanks God. But the fear of being COVID, the fear of being recurrence of COVID, the fear now everybody who is coughing, you are looking at him with the very, very curious view, and he himself, before that you never felt ashamed or embarrassed in coughing at the public place. But now if you are coughing in front of 4 or 5 persons sitting together, you are feeling embarrassed and you are feeling threatened. I would say that either you are going to be infected or you have already been infected. So this level of psychological stress would require multiple agencies to work and very dedicated and professional to address this challenge.
Thank you so much, sir. Now, I would like to invite our session chair, Dr. K. Guru Prasad, Director of Sri Vaishnav Institute of Science, for the closing remarks. Over to you, sir.
Thank you, Dr. Shweta. We had an interesting session by 2 eminent speakers on mental health and well-being. Madam Sujata Bhan spoke on the disability in particular in children and how to deal with it, and their education and the needs of their education and social accommodation. And we had a great detailed talk from Dr. Zaidi explaining to us about various aspects of mental health. He included everything in that, and he gave a very good suggestion that since the WHO has got only the mental and social well-being in their definition of health, when he included the spiritual well-being along with mental and social well-being, I think this is very much necessary, especially in a country like India, where you will see that the spiritual life is very much interwoven into our life, more than what I have seen in any other country, that Indians have this, they do have this involvement with spiritual things, and maybe it has helped them to a great extent in maintaining their mental health. I mean, that's what I believe. I do not know how much psychologists agree with it, but
Absolutely, you are absolutely right, sir. Absolutely
okay, thank you, sir. So that is the way I see it. I think we need a different definition for health, including not only mental, social, but also spiritual well-being. Maybe we can suggest this to WHO to include this, so that a large population of the globe, not only in India, are always with a bent towards spiritual solace in most of the things they do. So with this, I hand this session over to Dr. Shweta, and thank you for giving me this opportunity to be in this session.
Thank you so much, sir. At the end of the plenary session 2, I would like to thank our eminent speakers, Dr. Sujata Bhan, Dr. Zaidi, session chaired by Dr. K. N. Guru Prasad, sir, and Dr. Santosh Dhar, ma'am, Dean Faculty of Doctoral Studies and Research and conference convener, and present all respected directors, head of the institutes, HOIs, participants for giving their valuable time in the international conference MANOPRABHA-2022. I would like to thank our technical team for the flawless conduction of this plenary session too. Thank you, everyone.
And Shweta, can I make a small request
Yes, sir.
to this, particularly that I've been requested to chair a technical session at 2:30 to 4 p.m. But
Yes,
right
sir.
now I have received a message that VC is taking meeting at the same time because the examination is going on.
Okay, sir.
So I may not be available for that session. Please excuse me, and there would be one co-chairperson, and Dr. Pragya is co-chairperson. So if you could request her to chair the session, because please bear with me, I'm not available at that particular time. Otherwise, I always take interest and always look for an opportunity to have more interactions, but this particular time is not convenient to me. Just now I've got the message. Just now I've got the message.
No problem, sir. Thank you, sir,
Thank you so
for
much,
giving
sir.
your valuable time.
Thank you very much. An examination is going on, and
Yeah.
and the last working days, the week, she usually review the meeting, what has happened. So today it is fixed at 3. Fine. Thank you, Dr.
Okay,
Guru
sir.
Prasad. Thank you very much.
Thank you, sir. Thank you very much. And thanks to
Thank you,
everyone.
sir. Good afternoon.
Thank you. I'm leaving now.
Okay, sir. Thank you, sir.